Welcome to GutTalk TV by Deb, a YouTube channel focused on closing the communication and knowledge gaps in gut health. Please press the subscribe button below.
Hello, I'm Dr. Jakob.
Hello, I'm Dr. Yoon. We're the gastroenterologists from Australia.
And today we're going to be talking about a very important and very common syndrome called irritable bowel syndrome. So Dr. An, irritable bowel syndrome is very common and we see a lot of it in our clinics. And what exactly is it and how do people get diagnosed with it?
So irritable bowel syndrome is diagnosed on symptom alone. So you will get abdominal pain. So usually you should get about 1 day per week abdominal pain for at least the last 3 months. And it has to come with a change in bowel habit, whether that's frequency or the forms of the stool. When you get those abdominal pain with a change in bowel habit, then you are diagnosed with irritable bowel syndrome. However, it comes with other symptoms like a bloating, distension. So you look like you're pregnant, 6 months pregnant, that usually people describe, and you get flatulence. However, you can get other non-gut symptoms, which can be feeling tired all the time. You get brain fog, can't concentrate at work or your study. You can have migraines or worsening of migraines. You can get joint pain. Usually it also has a diagnosis of fibromyalgia in these patients. So that's what constitutes irritable bowel syndrome. Like then people would then ask, once you say you got irritable bowel syndrome, they say, what causes irritable bowel syndrome?
Yeah, well, irritable bowel syndrome often manifests itself in early life, so under the age of 50 is the time that most people are diagnosed or first start having symptoms of irritable bowel syndrome. We know that there is an increased prevalence of irritable bowel syndrome in people who've had infections of the gut that can sometimes trigger their IBS, or antibiotic courses that can trigger IBS. And although there are many different forms of IBS, constipation or diarrhea or various symptoms, and they all get kind of clumped together, there are a few themes that emerge. And one of those themes is the gut-brain axis. Yes. And so all of the nerve fibers that are in your gut, and you have as many nerve fibers in your gut as you do in the rest of the body actually, are sending signals to the brain. And these nerve fibers tend to be a little bit more sensitive in patients with IBS than other patients. So in some subjects it might just feel like, oh, my bowel's a little distended, but in someone with IBS that feels really like bad pain or agony. Those signals get transmitted up to the brain, and that's a phenomenon called visceral hypersensitivity. So these signals are coming to the brain where the brain senses them as being very uncomfortable, but then there's also signals that come from the brain down to the gut that can affect things. So if you're stressed out or if you have a lot of anxiety, then these signals are transmitted down to the gut, and that can change, for example, the motility of the gut to be either more frequent or less frequent, and that's kind of the gut-brain axis. The other theme that emerges is that the microbiome seems to be altered in the setting of IBS. So the bacterial communities that are in the gut are normally a healthy, diverse community, and in IBS they're somewhat altered. And this altered microbial community is thought to trigger some of the symptoms of IBS. And then the final component is the bowel itself and how permeable it is. We talk about increased intestinal permeability, sometimes referred to as leaky gut, and that basically means that the gut normally keeps everything that's inside the gut inside, but in leaky gut some of those compounds, chemicals, and other substances leak out of the gut and into the bloodstream, and that can give us some of the symptoms of IBS as well.
Yeah, but what to keep in mind is even though there's all these causes of irritable bowel syndrome, it doesn't have a pathology in your gut lining.
That's right.
So you can be diagnosed with a simple stool test that you can do through GP called fecal calprotectin. So this test will tell you whether you've got any gut lining pathology that will be ruling out other condition other than irritable bowel syndrome. But if the test came back as normal, then you can be reassured that you don't need a colonoscopy to diagnose yourself with irritable bowel syndrome.
We try to reserve the colonoscopies for people who have red flags, so symptoms that we really need to investigate further with a colonoscopy or an elevated calprotectin. Those patients do require the colonoscopy.
Yes.
And then I would add on one other thing about food, because I think that's an important component of IBS. While we don't think that food, or we don't understand exactly how food can help trigger IBS, we do know that IBS is more prevalent in countries with a Western diet or a bit westernized, and we certainly have foods that trigger symptoms in patients who do have IBS.
That's true.
So Dr. An, what would you say is your general approach to the treatment of irritable bowel syndrome?
So it affects various people. It's very common in the community. So everyone responds differently to different treatment. And that's why each treatment has to be personalized to you. But mainly our symptom algorithm is targeting each symptom that you're experiencing. However, in general, like a no-brainers. You have to sleep well, have a healthy diet, and exercise. In addition to that, you can improve different things, such as having a right food intake, as you have mentioned. And there's a certain food that actually triggers your symptom. You have to retrain your bowel. If you have constipation or diarrhea, you have to have a regular bowel habits by training your bowel all over again with a different help. Certain medication do help you, and you can also help yourself with the pelvic floor physiotherapy. They can relax your muscles to improve with the constipation. And lastly, as Dr. Bigan mentioned, it's a mind-gut axis that plays an important role. So mindfulness or psychological therapy will definitely help with your symptom.
Yes, even hypnosis has been shown to help with irritable bowel syndrome. Yes. Absolutely. And I think that, Dr. Ahn, you've emphasized that it has to be a holistic approach to the treatment of irritable bowel syndrome, but personalized to a particular patient's symptoms and also what they respond to or don't respond to.
That's right. And we'll upload more videos specifically looking at different aspects of management. I hope you find this resource valuable. And if you have any questions, please leave a comment below and we'll try to address that. Thank you.